Dr. Dello.
Thank
you for coming.
Thank you for having me.
Is LASIK permanent?
LASIK is a permanent procedure. LASIK involves an alteration of the cornea, surface of the cornea of the eye, and in doing so, the cornea is very accurately and finitely evaporated. People are only born with a certain amount of cornea, so the evaporative procedure of resculpting the cornea is permanent, which is why it's very important that it be done properly. People's prescriptions, one caveat to this is people should have stable prescriptions that are documented to be unchanged. That brings the permanence of the procedure. But in and of itself, a LASIK procedure is a permanent correction to the eye.
Can you go blind from LASIK?
It's possible that people can have visual loss, which may be significant due to certain rare but potentially very harmful flap abnormalities, flap infections, flap displacements that are not addressed. The published rate on having an infection that can be damaging to sight is about between 1 and 35 to 50,000 LASIK procedures that are performed. You should keep in mind what you're comparing it to. The incidence of potentially sight-threatening infection wearing contact lenses over an average course of a contact lens wearer's wearing history is about 1%. So that's a very high number, 1%, if you think about it. So you have to know what you're comparing it to.
Dr. Dello, what is a good age to have LASIK?
An age that, getting back to our previous discussion, that a person's prescription is most stable, or is stable. On young myopes, it's typically in the early 20s. I mean, the FDA guidelines allow for LASIK over the age of 18. That said, it's in the clinician's hands to make a determination about patients' suitability from a stability standpoint with their prescription. Nearsighted people, typically by early to mid-20s, is when you'll find stability. Farsightedness, which can set in later, you have to get a sense of the trajectory of the prescription, but that sometimes can take longer to become stable. There's really no upper age limits. We talked about lower age limits, 18 and above, provided all else being normal and equal. There are really no upper age limits per se, provided that there's no other ocular diseases that a person's appropriate. In fact, LASIK is frequently done after cataract surgery for touch-ups in the geriatric age group generally. So you know that it's widely done on a geriatric age group.
Dr. Dello, is there a season that it's better to have LASIK performed?
This is a question that comes up very frequently, and really there's no difference. I mean, this has been studied, of course. It's been a question since the beginning of the procedure, and many ophthalmology resident has had a project of studying this. There's really no difference. I mean, the temperature and humidity in the operating room is controlled within certain levels, and there's really no difference.
Dr. Dello, who's a good candidate for LASIK?
A good candidate for LASIK is a person without any significant or uncontrolled medical problems, with a stable prescription, with appropriate, in the appropriate age group, over 18 years of age. Someone with, like we said, with whose diagnostic, imaging, and all the other criteria that we screen for LASIK is normal, with a prescription that's within range, within FDA range for nearsightedness, farsightedness, and astigmatism, and also someone that has realistic expectations of the procedure.
How long have you been performing laser vision correction, Dr. Dello?
I have been performing laser vision correction in our centers here since 2000. 6 days a week, though, so like in dog years, that's several decades.
Why should a patient choose Dello laser vision for their lasers?
Because of our vast experience that we have, treating so many people, so many different prescriptions, and the wealth of knowledge that we've gained from that. Our commitment to the latest and great, constantly staying ahead of the curve with the absolute best equipment, which we've always done, and embracing each advancement in such a way that we can bring, a higher level of result to the patient and the highest level of safety. That's our commitment.
Can I expect to have 20/20 vision after my LASIK surgery at Dello Russo Laser Vision?
If your preoperative measurements of a person's prescription are for reach 20/20, then you can very realistically expect that. As a matter of fact, over 80% of people that we treat here achieve 20/20 vision, achieve a vision that exceeds 20/20, getting into 20/15 level of vision, visions that beat 20/20. So now, surpassing 20/20 is really our new standard.
Is LASIK painful?
LASIK is not painful at all. The numbing drops that we use are 100% numbing. It's impossible to feel the laser. No one has ever felt it. The drops that we use during the consultation will allow for, as part of our complete evaluation, can make people's eyes feel a bit heavy and dry. It's a little bit sticky. That's the feeling that you'll experience. That's about the extent of what you'll feel during the procedure, because the numbing drops are so absolutely effective.
How long does it take to perform the procedure?
The LASIK procedure takes 2.5 to 3 minutes to perform. The patient is laying on a robotic bed that we have. They really need to do nothing except lay there nice and comfortably. They are shuttled between the two laser stations on the robotic bed. The procedure takes 2.5 to 3 minutes to do total. Your total visit with us on the day of the procedure is something in the order of an hour and 15 minutes. A lot of that is paperwork and explanation of post-operative care and ramp up and ramp down, so to speak. But the procedure itself, 2.5 to 3 minutes in the operating.